these proceedings, may I bring to your attention some housekeeping matters. There's no expected fire alarm testing today, therefore if the fire alarm does sound, to meet at the assembly point in Civic Square. Can I please ask that you use your microphone when addressing the meeting and it's switched off thereafter? Your mobile devices are turned to silent. This meeting will be broadcast live to the internet and be capable of subsequent repeated viewing by entering the Warspite room, and during the course of the meeting, councillors are consenting to being filmed and in use of these recordings for webcasting purposes. Okay. Apologies, Roses, and so no apologies this meeting. Does any members have any declarations of interest with regard to anything on the agenda today? So that is none. The minutes on pages 1 to 8. Is there any comments with regard to the minutes? I do believe they're true and accurate account of previous meeting. So everybody happy? All right. There's no chair's urgent business for today. So it takes us to item 5, which is pages 9 to 18. Councillor Sudan, Cabinet Member for Customer Services, Sport, Leisure, HR and LD, that's some title, will introduce the report. The purpose of the report is to respond to the notice on notion from the council meeting in November 2023. So can I ask Councillor Dan to bring the report before us, please?
Hi, so for those of us who are in the council chamber, I think it must have been about a year or so ago, there was a motion on notice that came to the council about how people connect digitally with the council and just generally, and there were some queries on there. And if you remember rightly, I said that a lot of the work that was covered in the motion on notice we already did, and that actually it'd be much better if the points raised, I think it was by Councillor Salmon at the time, which are listed here, if they actually came to scrutiny rather than we messed around with amendments in the council, because then we could actually explain what it was doing. So to explore the following questions following the motion on council, one was to look at the current phone system, how it works, what its performance was like, how the phone system is advertised, how people know how to get hold of the council, where we promote the assessment of council contact centres and promote walk-ins, and to look at a suitable accommodation wherein face-to-face communication is possible. So we've brought some facts and figures today which sit within the remit of the operations that I deliver. But I want to make it absolutely clear that it doesn't cover all the ways that people can access the council, because I think that is a different conversation, and it's a conversation we can have at the next agenda item when we're looking at what the customer experience and customer strategy may look like moving forwards, which is a verbal report. So unless anybody's got any questions about why we're here, shall we have a look at the first slide? Yeah. So it says our contact centre answer call 668,000. Can I just say that it's a long time since the council has had anything that resembles a contact centre. So I think it's a term that we need to move away from. We're not on Amazon. We're not British Gas. We don't have any longer 45 people sitting there waiting to answer the phones. Those days have long since gone. A lot of this changed during and after COVID. When people during that period moved to a more digital interaction with the council. It also follows years of budget cuts, and I'm going to have to say that we've managed to keep the budget for how we work within business support the same for the last 2 years. But for the 2 years before that, there was a 700,000k, and a year before that, a £1.2 million cut in how we manage business support. So we do what we can with the resources that we have. if you look at the report in front of you, over a period of time from the 1st of April to the 31st of December in our customer hub, which is what we call it now rather than a contact centre, because we have some people based at Ballard House, but also a lot of people work peripatetically and at home. There was nearly 60,000 calls. On average, we answered 96 of them, 96% of them. It normally takes around a minute for that phone call to be answered, and you can see how long it takes as an average time, and sometimes how long you have to wait. I get weekly, monthly performance figures, and I have to say that sometimes our average wait times can vary dramatically from being picked up within 10 seconds, and I think the longest, if I take the 6th of the 1st, the longest time anybody had to wait was 27 minutes. So it varies enormously, because if you've got 11 people answering the phone, and some of those phone calls can be very long, because they might be from somebody's in children's, adults, social care. It might be somebody who's got a homeless problem. It could be somebody who's got a very complex need. So you can never tell how long, but we do our best. And you can see from the slide the sort of things that people normally ask for. Pete, anything you want to add to that slide?
Only out of interest that I rang the contact centre a few moments ago just to see what the speed of answer would be. Asked to speak to somebody on children's services. It was answered in 2 rings, just so that you get a sense of what's happening absolutely contemporarily.
Okay, next slide. We signpost our number everywhere, the 668,001. That is the number. And when it comes into the council, then when you ring that, there's a choice as to where it goes, and then hopefully it gets triaged out to the right team. And then the council tax and housing benefit is also another operation. We signpost it on our website. If we're putting stuff out on social media, we usually put the telephone number on, and we put it on all our posters and everywhere we possibly can. It's not a number that is difficult to find. So, yeah, and when it goes out with your council tax, which everybody gets every single year, the website, contact details, and the telephone number on that. So every single household gets that number every single year. Nothing else?
Again, only really to note on the slide we've shown, on the slide that's shown there, I've pasted in what's on the website. And interestingly, that page on our website, the Contact Us page, features in the top 5 pages on our website every month. Now, you might imagine that people call us because they can't access digital services in order to get what they want. The fact that that page on our website is accessed in the top 5 most popular pages every month suggests that some people have a need that can't be met by a digital service, as well as those wanting to look up a number and pass it to somebody else who may be digitally excluded. But I think the fact that that's such a popular page, I think, proves that actually we're not hiding, we're not withholding anything. This is us trying to provide an alternative to a digital-only face of the council, which is not what we're trying to do.
Yeah, and the last slide. So I suppose this is the most difficult one to explain, really, because we no longer do one first stop shops. They went out a while ago. But if you think of the number of buildings that we have across the council, there are loads of places where people can access. And we're trying to push our libraries and our health and wellbeing centres, and where we place community builders, so that we can, if people need to contact the council, it's not necessarily through a normal door. But in terms of what I personally am responsible for, we've tried to work with the library service to offer better accessibility. So I think the last time I came to Scrutiny, I was talking about how we're very much aware that not everybody is digitally able, and we need to make sure that we're getting better at trying to go out to people rather than expecting people to come to us. So I've got a couple of examples on here where we've tried to do that. So the first one was about the blue badge face-to-face offer. I've never filled in, but I have supported people filling in a blue badge application form. It's a government one, we don't have any choice over it. And it is not the easiest. And some people can manage it, and some people have family who can help support doing it, but not everybody can do it. So we decided that we would try to offer face-to-face appointments, and we'd use our libraries as an example of how we could do it. So we were going to do it in Plymstock, Plympton and St Budo. So we've had this offer going now for nigh on a year. And you can see that with the best will in the world, we offer people the smaller libraries, but do you know what they all say? Oh no, I want to come into the central library, please. I can go into town at the same time. So we are opening the offer for customers who want it, but as you can see that 200 people have taken the face-to-face offer in the library. It's a bookable service, so you have to book it, but you can see that that is an offer that is there. And this is where we're trying to use our buildings more effectively to offer a better customer experience. And we also do bus pass offers now as well, and that's been really successful. And then the last one is following on from a thing that we had when we last came to Scrutiny, was what do we do for those people who can't get into somewhere but they need assistance? And we've now got a digital assistance line, so that when people do ring up on the 668,000, there is a very strict criteria that you have to do to meet that, because we do not have the capacity to offer that as a service for everyone. But if you meet the criteria and you really are digitally not able to do it, you then get a little tag, and that people will know that you need digital assistance if you have to do anything online. So we're doing that where we're supporting residents who generally are not digitally able for whatever reason, but you just have to meet the criteria. If you remember, I said it's not for someone who thinks it's easier to ring up. It is somebody who is genuinely needing digital assistance. And we're doing our best. And I think moving forwards, there's a real balance about connectivity to our customers and what we offer them. And when we talk in the next section, which is about what we're going to be doing moving forwards, it is very, very much going to be about what that customer experience is rather than a customer service. Because a customer experience is when you ring up, it's when you go on the website, it's when you make any connection with the council for whatever reason. So whether it's a planning application, whether it's ordering your garden waste collection, whether you've got a housing benefit query, whether you're in crisis, we have to look at what that experience is, because people come into the council now in very, very many different ways. So we've brought the information which is directly related to the motion on notice, which is what is requested. So I hope that's all right. And if you've got any questions, then we'll be happy to answer them.
Yeah, just to say to the committee, I think Peter and I had a good discussion yesterday on this, and we felt it best that obviously, because the two are inextricably linked, to combine the two and then bring the recommendations into the end. So if there's anything, is there anything you want to lead into with regard to customer services, Sue?
Well, I can give you an update as to where we are with them, with customer service in terms of customer experience.
Yeah, do we actually want to break this down a bit as a topic? Because what we're going to do is have so much information, and then we're going to have to go all the way back. So rather than spend half an hour listening, perhaps we have a little bit of interaction, I suggest.
Happy to do that, Councillor Nicholson. I know you wanted to ask a question. Would you like to ask a question at this point on regards to that?
Lovely, thank you very much indeed, Chair. And thanks, Councillor Dan and Peter for being here. It's a very useful explanation we've received today, because I'm sure all members from time to time get instances where members of the public do express concern, and it's good that we know what the up-to-date position is. And I think terminology, I still assume that we're a pool of people, even the slide says contact centre, were there to answer calls, and clearly that perhaps isn't the reality. Could I just ask, because I do from time to time ring 66800, and the reason I ring it is that I'm not always, I might be out and about, and example, I need to speak to someone in the council, I haven't got the ability to, there aren't any direct dials, it's all using Teams really effectively to dial up a member of staff these days. I think the biggest bone of contention is that you go through that cycle of you press 1, 2, 3, 4 different options, and then you do that a number of times. It's generally only when you've gone through that a few times by holding the line, you get to speak to someone. Now, I haven't rung for a few weeks, Peter, but is there an option actually to press that you can speak to an operator? Because it hasn't historically been the case. And what generally this selection says is, if you want council to actually do it online. So what is the situation now? There is an option to actually ask to speak to an operator.
So if that circumstance changes according to need. So the first thing I would say is if you want to speak to anybody about council tax, there is an option for speaking to somebody about council tax, and you can get through to the team that deal with council tax queries. If you are ringing up about other general inquiries, as Councillor Dan has explained, if your number is registered as being digitally excluded, you will always get through, regardless of what you've called for. Doesn't matter whether you've called for something that actually we think is very simply done online or not, you will always get through to a person. So it's the phone number that's been registered against that person that gets you through to speak to an agent. For other calls, if you're trying to ring about children's or adults or electoral services, those kinds of things, the things that were on the slide, you press the right button, or you press the button that accords to that requirement, and you get through to the person.
Right, so I have had reason on out of hours to ring, obviously, to get the duty engineer from inclement weather, trees coming down and block drains and so forth. And you do generally on out of hours get an immediate service. I still, it'd be interesting, obviously you got the statistics, but you know, I've gone around that buoy of, so my number, my mobile number won't be registered as digitally sort of incapable, because I'm not. But I've had to go through the cycle. So you're saying that I still will have that cycle, won't I? So why don't you give an option potentially? Why have I got to sit there for 3 minutes going around the buoy, effectively being dissuaded from holding the line? And holding the line is an option. I just know that if I hold the line, eventually I'll get an operator.
Okay, so we have 11 members of staff that answer the phone. If everybody went straight through to an operator without being triaged, we would not have the capacity to deal with it, Patrick, Councillor Nicholson. That is the honest answer. And just to give you an example, I happened to ring a doctor's surgery this morning as an advocate for someone, and I was on the line for 28 minutes and I had to put the phone down. So it is exactly the same. We do not have the capacity. So sometimes you just have to call back. And that is the really, really honest answer. And if some would like to give me the 1.9 million that was taken out of the budget 4 years ago back, we would have more people answering the phones. We have to deal with what we have. If it is urgent, so if it goes to adult social care and children's social care, normally it's for a complex query and it takes time. If it's because someone wants to, for instance, order a new bin, quite often those conversations could take time as well, because the customer service assistants will work with the person on the phone to see if they're digitally able to do it themselves and give them directions to how to do it. So we're actually trying to empower our residents at the time. So I'm going to say it again, we do not have the capacity to answer every single call with an operator.
So through you, Chair, I totally accept Councillor Dan's point. I'd like to be more specific as a member of the authority. There are times when councillors are here obviously needing to get immediate action. And I've had instances, a couple of instances very recently, where members of staff do not use Teams. So you call a member of staff and they don't. Well, it's all part of the customer. I'm a representative of the public, as indeed other members are, trying to get a customer response from the authority, and you're the Cabinet Member, Councillor Dan, hopefully assisting in this. So I wanted to take it a step further. The member of the public's not been able to get the service they expect. They've got an issue that they want resolved, so they come to their elected member. I accept that technology has a massive part to play, but there are members of staff that aren't really participating in Teams. So could we, through this panel, be asking that that be taken on. I don't know if it's your area, it's probably Peter's, as the officer responsible, that we need all members of staff. If councillors can't ring and speak to a member of staff, then through the normal telephone system, then staff should be expected to use technology and Teams to accept calls and Teams messages. And that it shouldn't, that there's other medium other than email. Sometimes it's helpful to talk something through rather than actually emailing and trying to do messaging. So I think there's I accept what's being said in terms of members of the public, and I think it's good that members of the public who have not got the ability to use a computer can register a telephone number. But there are issues that elected members, I think, from time to time, are having a worse service than members of the public in trying to represent the constituents. And I hope that could be fed back and some reassurance. And I can give examples in private of officers who, despite ringing them and messaging them, you get absolutely no response. You try and ring the number and you can't get through. So, what are you supposed to do?
Okay, I think we've got two things going on here. So I'm talking about the public because this is what we were asked to come back today. Councillor Nicholson, you're talking about councillors and councillor casework. And I think the two have to be separated because we have a casework system where councillors can go onto Firm Step or they can send an email to the councillor casework team and it gets dealt with through there. So anything that a councillor brings in should go through that councillor casework process. And I think, I beg your pardon, I'm speaking. So, and I think that we need to separate the two. So this is about the public facing and the customer experience. You're talking about the privilege of being a councillor, and then you have to go through the councillor casework system. And the reason we ask people to go through the councillor casework system for any members of the public who might be listening is that sometimes councillors have very sensitive, complex needs, and they're not just service requests. And then anything that goes through the councillor casework system can be tracked properly. If you send direct emails and have direct phone calls with officers out of the blue, sometimes they're not tracked properly. So it's for safeguarding the councillors and the residents' information. So I think for this purpose, we are looking at the whole of the councillor casework system. Some members here might be part of the new councillor casework way of working, and we're looking at this back front, right to the back end of the process to see how we can improve this and how we can improve the responses for councillors. But that is very, very different from what we've been asked to bring today, which is about the customer service system and the customer experience that members of the public have. They are two very, very different streams of work.
I have to say, as chair, I totally agree what Councillor Dan has said. But however, I think you have a legitimate point that could be summed up in a recommendation that then comes back to us. Because I remember years ago, a lot of people complained that as councillors, say 20 years ago, you had a councillor handbook with everybody's contact numbers in there. So if you contact development points or whatever. So I take that on board. But I do think, Councillor Nicholson, it is a specific point. And if you wish to explore it, I don't see any reason why it can't be put on the work programme to be discussed as a separate item of concern. I do appreciate that councillors do, if they can't get hold of if the members of the public can't get hold of people, they do tend to use us as a backstop, and that can produce quite a bit of work. But that's something then we can discuss at that point in time, if you're happy with that.
Well, I don't think it needs to be a work item. Certainly we can have a conversation outside the room, but the power of conversation is a very important medium in actually resolving issues. And I think expecting members to be puppets on a system that you just pop it in and you get a satisfactory response in many respects, but there are times when you don't get a satisfactory response because you need a conversation. So I think trying to have a system where members are restricted in having a conversation is complete nonsense. Certainly I've done very well over the years in having many conversations about many of the affairs of Plymouth and St Mary Ward to the satisfaction of everybody, both the council and members of the public. So I think discounting the ability to speak is not right, but we can tell that we're going off on a side, and I don't really want to go down, although I raised it, I appreciate Councillor Dan isn't here to talk about the way councillors interact. What I would say is that there are times when a phone call from a member of the council on 66 needs attention as much as a member of the public. And to say we stick it in councillor's casework and you get a response in 5 days, if you're lucky, if it's urgent, it's not a satisfactory response. And if Councillor Dan thinks that's adequate, I beg to disagree with her. But we can take that offline elsewhere. I generally always get a satisfactory response from the organisation. Sometimes it may take longer than I'd want, but I'm pleased that the presentation that has been brought today at least updates the public and members in relation to the council's interface with the public, and that's what this report's about. Thank you.
Yeah, again,
Oh, sorry, Chair. Can I just say that I didn't say that councillors were not allowed to have telephone calls. All I was saying is that councillors generally have a different route into the council than using the public telephone line. And no way did I say, or even intend to mean, that councillors were not allowed to ring in and not allowed to have conversations with officers. I was just saying that councillors quite often have a different route into the council than the public telephone line. Thank you.
Okay, thank you for clarifying that. Councillor Gosling, please.
Thank you very much, Chair. Just an attempt to get back up to the agenda and the remit of this actual committee rather than the hobby horse of various councillors. I'd like to ask a question through you, Chair, about the trend in the calls to the Consumer Hub. So I understand that the aims and your stated aims of the communications is to move as many people as possible to more efficient means, digital methods of interaction with the council. So is it known how the total calls received are changing over time? Are they going down? Are they flat? Are there particular services which tend to have an increasing or reducing trend in calls? Where are we being successful in getting our customers to digital services?
I think while Councillor Dan looks up some data, I can give you some general points on that. So perhaps some background first of all. What you've got on the screen obviously is how many calls we take. What you might be interested to know is how many times our website gets visited and how many forms get filled in digitally as a contrast to the number of phone calls we take. So approximately 60-odd thousand on that period between April and December last year. In the same year, we will have had about 3.5 million hits on the website and several hundred forms filled in requesting service from us. So that gives you a sort of sense of the channel mix that we're dealing with. The vast majority, and I would estimate it's probably 95% plus of our contacts from the members of the public about general service inquiries are now digital. To answer your point about trends and what's happening with calls into the contact centre, that's really seasonal actually, and sometimes it varies according to the nature of the service. So we get more calls around council tax and revenues and benefits generally around main billing time, not surprisingly, when we're resetting people's direct debits and that kind of thing. That generally triggers a peak. On the elections line, you'll not be surprised to hear canvassing, and then the election itself generates a peak in that, and that goes off until the next election. Children's services and adult social care generally are reasonably flat actually. There's not a known peak that I'm aware of in those types of calls, and that seems to be relatively steady. The trend overall for calling is flat to declining, I would say, but that is not true, as I say, when we go into an election period that might be around main billing or something like that. Then we see a peak go back up again. So it's a really fluctuating story, but I think that the overall trend over the last few years is reasonably flat. If you
Can I just interject a minute, Peter? Sorry, Jeremy, you got your mic on still? So I may not pick it up. All right, sorry. Carry on, Peter.
Yeah, I think overall the trend would be more or less flat, ignoring the seasonality and the other peaks that occur as a result of the cycles in our business.
Thank you very much. Slight delay there, it's just confusing me now. So given that we're putting a lot of effort, we have put lots of efforts over the last few years in moving services to digital platforms, and that we are doing, as Councillor Dan has intimated, that we are having discussions. If someone rings up about their bin, we say, can you go, we're educating customers in trying to move them online. Why would you say that the sort of overall annual call volume is relatively flat? Are we being successful in moving people to digital services, or are these calls basically a a section of society who are just unable to access or use those digital services, and that's what we're left with, and that's what we can expect from the future.
So I think you are looking at some of the more complex needs coming through on these funds, and that is a sort of a relatively steady set of demand into the council. The other thing I didn't say is the trend in terms of digital uptake. So we are seeing year on year 10% plus increase in digital demand, right? So that's where the demand is going. It's going on to digital. What's staying relatively steady is our call volumes.
And also, Councillor Gosley, when you look at the call areas, homelessness, children's social care, adult social care, and SEND and things like that, they're in those areas where we've got growing demand. So it's no surprise that the call levels in those particular areas of our delivery remain high, because I think once you get into one of those areas where you need support, quite often the support you need is quite complex. You can't do it over a phone, over digitally, because you're asking probably for more than one or two services.
Councillor Poyser.
Thank you, Chair. I was just wondering about how we're shaping our services, because I know the next part of this is going to be around, strategy piece as well, but how we're using data to shape that, maybe customer feedback, responses, survey work, looking at demographics, backgrounds, ethnicity, language barriers, that type of thing, and how people can interact and how we shape those services either by phone or online or whatever that might be for various different requirements. Are we using that information? Have we got that information?
Do you want to say what we're using now? And then to answer that question fully, Chair, it's probably moving into where we're going.
Yes. Are you happy to carry that over?
Yeah.
Yeah, okay. Yeah. Do we have any way of collating the data over a period of a number of years? How many people have used different access points to the council services? Would it be wise? Would you be happy to receive a copy of that so you get a complete breakdown of the various access points as committee members? Yeah. Yeah. If we could, all I could ask is that the stats are actually forwarded to the respective members to give the breakdown, and I suppose then in future you can see the particular trend and where we need to be going, just to clarify some of the points that have been raised here today. Everybody's happy with that? Okay. So if I take us then into the customer service strategy update, again, can I ask Councillor Dan and Peter Honeywell to introduce the report on this one, please? And you'll see how the two are linked then.
So this is a work in progress. So you'll be aware that we haven't had a Chief Operating Officer in post for quite some time. And at the moment we've got an interim officer, which is Jens Gemmel, who's here. So we're working on, it's wider now. It's not customer service anymore because customer service is too narrow. When I started, I said I'm talking about the customer experience. So we're working on a customer and digital experience strategy because they have to be combined. So it will be overarching over all of our services. So it will be over children's social care, adult social care, homelessness, business support. Everything that the council does will have this overarching customer experience strategy, because it's not about customer service and customer experience. It's not about when you ring the 668,000 number anymore, or when you go onto the website. It's much wider than that. And you'll know from when I came to Scrutiny a couple of weeks ago as well, that there is a transformation programme looking at how we work and how we can work more efficiently and more effectively and using modern technology. So just 2 weeks ago, we had 2 days in the council where we had lots of, I'll let Pete explain exactly what it is, because I'm afraid it's a bit too technical for me, but we had loads of people coming in showing how we can use AI and digital platforms to help support our services, which comes back to what you were asking, Councillor Poyser, about using data. And part of this overarching then experience will be, where do we need to focus our services to best deliver the services that our residents require, so that we can be more focused and we can join things up better and hopefully then prevent people. So perhaps, let me give you an example. So if somebody comes in to the homeless team and they've lost their home, there's probably going to be more than one reason why they've come to the homeless team, because they've lost their home. It could be that they're already in the system somewhere, and how we best can connect all the stuff that we know about a particular person or a particular family to best look after them and support them in crisis. Now, to do that, you need to have an overarching strategy which pulls things together about how we can deliver the best for our residents, which is where we want to be. So to do that, you need to have teams set up to be able to support that person. You need to have the digital platform set up to get the information and pull it in. So that's when you're reacting there. But what happens if we can turn it on its head and actually start using that technology to spot when people might be coming into trouble or might be coming into crisis, if we can intervene first? And it's also about then looking at neighbourhoods. And again, this comes from what you were saying, that if we know that in a certain neighbourhood there seems to be an issue with, and we can start targeting that neighbourhood in different ways to try and improve communities. So there's lots of ways we can work better. So that's one. The second thing, and the reason it's digital, is that when you ask the question, Jeremy, about the calls, we know we've got increased demand in adult social care and children's social care and homelessness, and that demand is not going to go away. But our budgets to deliver it are not up here with lots of capacity to deal with that demand. That's sort of down here. So how do we manage this increased demand with a budget that isn't going up? And somehow we have to look at how we can use modern technology to help support the work we do, to release staff to be able to do more complex work. So, for instance, one of the things we will be looking at in a couple of weeks is a demonstration on how AI can support social workers, for instance, or adult social care workers do some of their reporting, do some of their plans, so that instead of someone actually sitting there typing it all up, you have an AI support which is still managed and checked by a person to do that work for you. But then that person then gets on to deal with the person who needs the help rather than doing an admin task. And that's how we're looking at modern technology support the work we do. It's not a cost-saving measure. It's to help staff, to free them up to deal with more complex needs. And this is going to be a whole system. It's a whole council approach. It can't just be done in isolation. So in terms of where we're going, that is where we're going. That's the journey that we're on. And I'm hopeful that by the summer, we can bring back to Scrutiny what this will look like, so that you can get an overall picture and ask questions and make sure that we've covered off everything that we need to do. Because this is no longer a contact centre, a customer service thing. It's about how the council has an overall arching customer experience wherever you come in. So that's quite a bit of a grandiose description. So that's the politician's answer. Now, when you want the technical stuff, I'm going to very do my sleggy shoulders, pass it over to Peter, who's got a much better understanding, obviously, because it says expertise in how that's going to look.
I don't know that there's a great deal more I can add that is going to answer the business problem that we've talked about. If people have got specific technology questions, I'm very happy to take those. Councillor Dan's just mentioned the couple of days that we had away where we looked at a range of new technologies, some that were all about actually helping us to understand and profile the needs of individual communities or the city as a whole in order to put targeted interventions into smaller community groups, say through the library or the family hub that exists to support that area. And really understanding the data that we can reach, not just in the council, but actually we can reach outside the council, use the data to make sure that we've put enough provision, specifically targeting the needs of that community that access point supports. We also looked at some of the tools. Again, you've just given us some really interesting sort of taster on using AI in a way that will help people to take some of the admin out of their work, or even do the first cut of a report. So education healthcare plans that are provided for children that perhaps have got health or other needs to keep them in education, but to put additional support around them, require an input from educational psychologists, the school, the medics that are dealing with them, the parents, etc. Those are quite complicated pieces of work to do. And actually, we saw a piece of AI technology a couple of weeks ago that took all those inputs and produced the first draft of the education healthcare plan. It wasn't, and it should never be treated as the AI producing the final draft, because the AI doesn't understand the same level of experience that a trained professional will, but it takes 80% of the hard work out, and it gives you a draft that you can then review. It shows you where the information that's gone into the healthcare plan has come from, so it audits it back to parental input or educational psychologist or whatever. So it gives you that starting point. You can then add, as the expert, the 20% that's missing. And what we're doing is we're bridging the gap between the graph of demand and cost and the capacity that we've got as a council with extra productivity for the individuals that work here to try and close that gap by raising productivity off. So that's how we want to use the technology. There's one other thing I wanted to just mention in response to your point about data, because I think we've talked about some of the transforming powers of data and technology, but right now we've got data, right? It's not that we've just started from a clean sheet of paper. We know what gives people problems when they're using our digital services or our phone services. So I can tell you now that what's happened over the last 3 or 4 years is cameras on mobile phones have got that much more powerful. There are more pixels every time you take a picture now. And what that means is the file size for a photo of a pothole or a piece of graffiti is now much bigger on a phone, right? It just is. You can take my word for it. And our website has, until fairly recently, put a limit on the file size for the photographs. And it's meant that if you've got 3 or 4 pictures, you can't upload them all. So we've just started to play with the idea of actually we're going to need to increase that capacity. It might mean that we've got to put more bandwidth in and things, but that sort of thing where we've been told by customers through their feedback, this doesn't work, I want to put these pictures in, we can act on that. And actually that feedback is being looked at by my team month in, month out, going around each of the areas, trying to take the feedback, because customers are really good. They do tell you when something doesn't work. They'll often write with a report on the feedback request and say, couldn't do this, or I did it, but it was a pain, and can you make it easier? Payments is another real classic issue for some customers. Most of our website doesn't require payment for most of our services, but when it does come to taking a payment, often we have to ask the customer to go on to a payment form, and then the bank that clears their payment, their banking account, will often give the customer a payment code or some other form of identification that says, this is you taking a payment out of your account, isn't it? And it'll send a text message or some other form of check to the customer. Now that confuses some of our customers, right? And we've got to work in the communities with some of the groups that we can now start to identify who are giving us that feedback to say, come to a library, we'll run a session with you about how payments work online so that when you next register for garden waste collection, you can put the payment onto the system and be confident it's not a scam, nobody's taking money away from your account for reasons other than your intended purpose, and it's perfectly safe. And we need to build more confidence and trust with our communities. And that's a really good way of actually taking the feedback that we have today and starting to direct that back into service offers that will make a difference to customers. So that's another example of the data we use.
Yeah, Peter, can I just come back to you? When we studied AI 25 years ago, I said one of the biggest problems we came up against was AI has no emotion.
Yes.
Yeah, you take emotion out of an argument, it becomes extremely difficult. So how far is AI going to progress within the council? Is it actually going to physically lead to decision making? Is that the ultimate goal, that AI will take over decision making? Point one. Point two is when we look at the cost Obviously, the cost of the AI that you're putting in is another layer. What is the cost of that in respect of, say, how many jobs would otherwise be utilised against the software implementation?
So those problems 25 years ago are contemporary right now. So they haven't gone away, unfortunately, and we haven't really solved them. What we can say is that we will have policies and governance, and in particular, we will look at the ethics of the use of both data and AI, and we won't be deploying AI to make decisions that are sensitive or important for our residents. We will be using people to do that. That is not going to, AI is not going to sweep away the judgments that are required in order to determine whether an education healthcare plan is appropriate for a child. It's not, right? So that is absolutely clear, and we will have a board essentially looking at the application of AI and or smarter use of data to make sure that we've got the right permissions, we've got the right consents, and that we're processing that data in the best interests of our residents, because that's what we're here for. That's what public service is. So I want to give you that assurance. You asked me as well about cost and return on investment, Councillor.
Yeah, obviously AI in itself produces a cost, the cost of the software, the integration of the training of individuals to operate the AI, to analyse the data that AI produces. What is that net cost to the council?
So I can't say at the moment where we will go with that. That would be the same as any investment we make in technology, actually. And what we do, and this will be true for AI, it will be true for any technology investment, is when we put forward a case for changing a piece of software or bringing a new piece of software into the council, we look at what's called the total cost of ownership. That is to say, not just the purchase price, but the training price and the maintenance price, assuming it has a life of something like 5 years, because most pieces of software do. We take that as the total cost, and then in order to work out whether that represents good value, you can look at classic return on investment type cases. But in this case, as Councillor Dan has explained, we are already underwater in terms of the level of demand that the council is facing and the backlogs that that's creating and things. And what we're hoping this will do is it will raise the level of productivity. So we're looking at the value that we're creating by meeting service demands for our residents. And we will be hoping that over time we can use data in a much more intelligent way to target interventions earlier in the life cycle of families, children or adults, whoever it is that's out there, in order that the expensive bills that we get when a family hits crisis can be covered by an intervention that's cheaper much earlier in the cycle that leads to that crisis point.
Yeah, but that provides a very good oversight of cost-benefit analysis to that. But obviously, I think it's something we need to keep on top of going forward. I suppose most stringently is the way the laws are changing in regard to the use of AI and the data, GDPR, whatever. It's all got an implication to that. So, can I bring in Councillor Dingle, please?
Thank you, Chair. Just picking up on what was being said about the service that's being offered at our libraries. I've recently attended a number of community events that's been offered at our local library within my ward, and I have to say I was very impressed with the quality of service that was being delivered within our local libraries. So obviously to see that, the community library visits account for around 2% of face-to-face meetings. I was just wondering, are we missing a trick here? Is there more that can be done to encourage residents to engage with our local libraries, considering, the quality of service that is being offered?
So this is quite interesting. So when you look at the 2% of those people who have face-to-face visits, they're offered either their local library but they choose to come into the city centre. But working closely with the library service and Councillor Sally Hayden, we're looking at what other services we can put into the libraries, things like skills, for instance, where we can use the libraries as a hub to bring local people in. So the answer is yes, and that's why when I talked about the customer experience, it's not just any longer about answering the phone and going through the website. It's how can we improve that customer experience across an umbrella of services. And yes, the answer is yes. And we want the libraries to use more, and we want more footfall. And, if someone is going into the library, if we can offer other services there as well, then we are, and we're building it. but it's also interesting about where the person, the residents, wants to go. And I think there's definitely a piece of work moving forwards about what we can put in libraries that people want to access there. So rather than us assuming that people want to go to libraries, is actually doing it the other way and actually using the library service to find out what people would like to see and how we can do that. So I think it's an evolving picture is how I would describe it. Is there anything you want to add?
No, I don't think there is, I'm afraid.
Any further questions from the panel? No. Councillor Poyser.
Thank you, Chair. Clearly, Peter, you're very passionate about this subject. I can hear it when you're talking about AI and the use of technology, and I think we should be embracing AI. I think there is an opportunity there for us to load shift, to free up officers' time for more complex cases, most definitely. You mentioned productivity, improving productivity. But increasing productivity can't go hand in hand with cost saving. It just doesn't happen right at that point. And there was so much in what you've said today. We could have a conversation for hours about things. It's something I've been involved in as well with AI in education, so I've seen the benefits of that as well, so how it can work. You mentioned, Chair, about the return on investment, and that was where I got a little bit, cost savings, return on investment, how would that work? But then it led me to think, is there any government grant funding that's coming down the road to local authorities to help invest in this technology? So that's the first question. The second question, if I may, Chair, and that was just, you touched upon data sharing as well, and obviously there are all kinds of laws governing that as well. And I think it's really important that we're really open and honest and transparent with our residents, that if we're employing this technology to share data internally, whether it's to get a better understanding of our communities or families and their needs, that we're really open about that from the very onset. We don't, because that can lead to a lot of mistrust. So how would we tackle that? So just, if that's okay, Chair.
I just answer something. So this return on investment, I think it's too early in the conversation to be able to answer those questions. And simply because it's not going to be a very simple answer. Because a return on investment in productivity may not necessarily be a traditional one. So if a return on investment is, I'm just going to pick figures from the air. We invest £1 million, and that saves us over 10 years, £5 million of what we would have had to have spent on increased demand costs. That's really a difficult argument and the thing to explain. So I think when this has been worked through, how we measure the success of the different ways of working might be quite different in ways we normally as a council look at how we spend money and what we get back from it. So I'm just leaving that there. There isn't an answer. We can't give any more of an answer than that, but I think it's quite useful to say it. But in terms of data, you're absolutely right. So when we went on these 2 days, we spent a lot of time talking about governance and safeguarding and protecting data, which I'll let Peter talk about. But we are already doing it as a council. It's not as if suddenly we're going to start using software and technology in a way we've never used before, because we have something called a low-income family tracker, which we have used very successfully in identifying older people, for instance, who are not getting all of the credits and support payments that they should do. So we're already using it and across organisations. But the data sharing is really, really important, that it is kept and managed effectively. So I quite agree. So so it's an expansion of what we're already doing.
I'm trying to think about what I can add really to what you've just said. I guess on data sharing, one of the important things is making sure that actually customers give us the right level of consent in order that we process their data in a way that they're content with. And for some customers, informed consent might be hard. This is quite sophisticated stuff. It's, you know, we're using data in all sorts of different ways with the potential for implications that might be harder to perceive instantly than is obvious. So, you know, I think the challenge of informing customers sufficiently such that their consent is meaningful, it is an informed consent, will be quite a daunting one for us. But I think the way that we will try and approach all of our use of technology to make sure that we don't fall foul of not getting the return on investment will be what government are now calling test, learn, grow. And what they mean by that is start small, thinking big, but starting small and using technologies that aren't necessarily our systems. We don't have to go and buy servers. We can buy out of the cloud to buy on a pay-as-you-go basis and to try 50 transactions at a start. So starting really small and just see whether 50 transactions generate the kinds of results that we want. And if they do, go and buy some more. If they don't, stop. You haven't spent any more than whatever 50 transactions cost you, and they're often pennies per transaction. You might have to train the staff, and that's a sunk cost, but you then learn from what you've just gone through and apply that learning next time to refine your approach, get something better, and then eventually hit upon the thing that really drives benefit and grow that massively very fast. So this idea of trying to, instead of buying a server, buying the software, buying people that have got the right skills to maintain it, which is all high upfront cost, you buy that from what's called the cloud now, and you use the cloud to make sure that your investment curve much more closely ties to your benefit curve, if you can imagine that. So test, learn, grow will be one of the things that we talk about to try and safeguard the council's financial interest in these investments.
Very informative, Peter. Thank you for that. I think the most important thing that comes out of this afternoon is that we need to be accessible to the public we purport to serve. There has to be various gateways and access for the publics. And I think most importantly as well that we have a single signpost in sight. Maybe the central library becomes a central point, a customer service point. Would it be worth putting somebody in there so that if anybody was to walk in off the street, they can actually interact straight away with the council to use the existing facilities? Would it cost much? Do we have that facility there currently, or is it something we could possibly consider going forward? So that as those that don't want to use the online, those that can't get through on the phone, if there's something urgent, they can say, okay, I can go to the Civic, I can go to the central library, speak to somebody, just get that a bit of advice and that assurance that they may need at that moment in time within a satisfactory time period.
I'm going to say it will come in whatever the customer experience journey looks like moving forwards. I'm not going to sit here and ad hoc make decisions about what's going into a library because you don't know what we offer 300 and goodness knows how many services. We have no idea what a person wants. And if a person is going in and asking a question and needs support, you need to make sure that they get the right answer. So the answer to that, Councillor Finn, is that if you go into the library, they signpost anyway and they can book callbacks. So if, for instance, you need to have a callback because you've got a housing problem, they can take the details and all our services do callbacks. So the libraries can deal with it, but it's not a first stop shop. It's not a place where you go in and get that answer because we have to make sure that if a person requires support, they get the right support. And you don't know what they're going to ask the question on. So, you know, we can signpost from the library, yes, so the answer is yes, but they may not get the answer to their question at that point because you don't know what it is.
Yeah, I fully respect that and fully respect there's so many various functions that the council provides, therefore it would be impossible to have them all under one roof to be able to answer those questions. But I think the main thing was that somebody can go in there, they can put forward a question and somebody take that on and make contact thereafter from the relevant department, whether it be planning, social, adult social care, whatever. So needless to say, thank you to Councillor Sudan and Peter for their contribution this afternoon. The recommendation is to review under the improved public connectivity is to review the data provided in response to the motion on notice and consider whether further actions are required. And on the item 6 on the agenda is recommendations to note the verbal report. Is there would anybody like to add anything to that?
It'd probably be useful just perhaps a sort of a holding recommendation that for Councillor Dan and Mr Honeywell to bring any further information to scrutiny as and when, you know, things are updated in the future, just basically keeping scrutiny members updated, because you know, these things do move on quite quickly, don't they? And it'd be good just to, you know, use scrutiny as a method of communicating any change.
And we will do perhaps the trends for the last 5 years.
Yeah.
I think that would be really useful for you to see about how the, you know, interactions digitally have overtaken interactions on the telephone. So sort of, if you did it from pre-COVID to now, you'll see a massive change in how people contact the council.
Like they say, there's nothing like raw data, and raw data in front of you showing the access points, etc., is a very good idea, and I thank you for that. Councillor Poyser, just to finish.
I was just thinking off the back of that as well about how people access the services, the types of people accessing types of service and their preferences. So people that are using the phone, what type of person is contacting and using the phone and for what service. So it's trying to understand that, break it down a little bit more. So we've got a much clearer idea around how people are interacting and engaging with at different touch points with the council. So if that makes sense.
Yeah, I think that might be a challenge for us to do profiling on all those that are using that service. We might be able to do something more generic for you, and I'll have a look at what we can do and bring that back, of course.
It was just whether we had any customer feedback, which also had other profiling in it, which would allow us to, maybe that's where the data is, yeah.
All right, like I said previous, thank you both for your time and for your contributions this afternoon. We're just waiting for Councillor Chris Penworthy. Yeah.
Yeah, sorry, I'm rubbish at this declaration thing. My employer is mentioned in the next report, Young Devon.
Okay, thank you for that, sir. Said there'll be any problems with that. All right, so we're looking at item 7 now, homelessness and the rough sleeping update, but also something that was asked for when I first convened this committee was that to invite the housing associations along to discuss the amount of voids, housing provision sort of going forward and where we stand with regard to issues on housing specifically. I'm pleased to say that thanks to the hard work that Rosie's done in the communication, we're going to have representatives from Plymouth Community Homes and Live West that will be available to answer any questions you may have on that, on specific points in regard to housing and housing provision by social housing providers. So I'd like to say thank you to them. Others were invited, however, we've not had a response from. So we'll take the two biggest as a win. So as any questions you wish to formulate and put to them can be added and brought forward. All right, so what I'd like to do now is that Councillor Chris Penworthy, Cabinet Member for Housing, Cooperative Development Communities, will introduce the report. Phil Burgoyne, Interim Head of Neighbourhoods, Homes, Communities and Plymouth Community Homes. Rob Cock, Head of Delivery, Live West. and Victoria Allen, Chief Executive of PAF, will also be in attendance to respond to any questions. The purpose of the report is to provide an overview of the homelessness challenges in Plymouth, coordinated response to address the challenges for the information and consideration of the scrutiny panel. But I must also add that it's also for us to see what we can offer, how we can work with the housing providers and what can we as an organisation offer them as well. So it's a two-way street on this one. So if Councillor Penworthy, if you can open, please.
Thank you, Chair. We are, first of all, I'd like to present Victoria's apologies. She's been here since 2, but she has a board meeting at 3. So she had to leave a few minutes ago, and it's a board meeting she really does need to be at, because there's a piece of work which is very technical about how housing benefit can be reclaimed and who can maximise the reclaiming of housing benefit for temporary accommodation. And PAF are just about to sign an agreement, subject to board agreement today, that will mean that they will be able to maximise the amount of reclaiming of housing benefit from national government and relieve a substantial pressure on the council, which we've been budgeting for next year. We'd hoped it would happen before, but if she's not at the board meeting, that won't happen, and there would be a financial risk to us. So I'm sure you will excuse her not being here, but we have been talking about this. So in terms of homelessness, we all know that there is a housing crisis. If we were to look at our numbers pre-COVID, we were a marker on the extremes because we were doing so well. We've since become a marker not because we're doing so badly, but because in catching up with everyone else, we've had a big swing. It's not that we're the worst performing in the country, it's just that we were doing so well that there's been a swing. So we're trying to turn around a super tanker, which is difficult enough in a calm sea, but we're doing it with wind and waves and everything else. And that's the reality of what we're facing. I think one of the bits that brings us strength in that is the work that we have been doing for years on building really strong partnerships across sectors, not only with registered providers, but with others working not only on housing, but on tackling some of the complexity about why people are homeless. And so the whole area of the Alliance contract, which also addresses issues of substance abuse and alcoholism and mental health and trauma and all sorts of other things, are all brought into how we handle that. So the Alliance contract is much broader than just homelessness, but what we tend to find is the real complex lives. Homelessness is currently or has or is about to become a key part of that complexity. So homelessness sits at the sort of crux of that. Just over 18 months ago, when I picked up this job again, I was concerned that bed and breakfast use during COVID, when government was supporting us to bring everyone in and not really ask lots of awkward questions, had continued on that trajectory, even though awkward questions were being asked and not everyone was being housed, because there is legislation about who is entitled. And we have become very dependent on bed and breakfast and other pay-by-night accommodation, where we can reclaim hardly any housing benefit and people are not living in appropriate accommodation for long term. And we didn't really have any answers on the books. The purchase of some MOD housing by Plymouth Community Homes, which has now gone through, was about the only thing on the table, and that wasn't really going to address the big range of need we had. So we set out to do a number of things, but the 3 key things we set out to do were to increase activity to prevent people becoming homeless in the first place. Now that can happen with us, it can happen with Citizens Advice, so not part of the Alliance, but work with us on our Advice Plymouth contract, and working with people like PAF and Shekinah and others, so that actually we didn't have to house someone in the first place. We could actually look to see what we could do. Now those numbers of people coming to us are rising. Actually our prevention cases are rising too. So actually we're doing really well at stopping people becoming homeless. We can always do better because people can become homeless, but that's really good. The next was to reduce reliance on pay-by-night accommodation, whether that was bed and breakfast or Airbnbs or holiday lets. and to increase the amount of temporary accommodation we have, partly because the whole housing benefit regime changes, but more importantly because whilst it is temporary, it is still a better quality of accommodation than that which can be offered by a pay-by-night. And we wanted to put a real focus on families and children, because children and young people, because we know that for those the impact was going to be most long-lasting. And the figures in front of you show that actually we've managed to make a massive change to the numbers of families in bed and breakfast and in bed and breakfast for a period of time. That's continuing. And we're now on the basis of that and the focus around domestic abuse, moving now to also look at what we do for younger people, especially those who are care experienced. And in the pipeline that we've described to you, we show that where that is our next big push, and that's been recognised with the largest CHAP funding agreement for an individual project anywhere in the country, and for us doing better than any other council in the country, including Kent, on this. And I think that is a sign of the government investment there, is because of all the partnership work we have in place. That means we've got really strong business cases and we know our client groups really well, and we can come up with some solutions. If Victoria was here, I'd now hand over to her for her to talk about the practicalities of what Path is doing. Path, 12 years ago, had no temporary accommodation and are now one of the biggest temporary accommodation providers in the city, and we've been working really closely with them on that journey, helping them with leases, lending them money to purchase properties, so that we can actually get that out there, and they're also supporting on managing other people's properties, so really positive stuff. Also the work they do with Rough Sleepers and that team. So there is all of that happening. I'm sorry you haven't got that experience. We've been working with housing associations, so general needs housing, rather than saying anyone can go for absolutely everything. We've been allocating 50% roughly of lets on general needs as they come on to Devon Homes Choice to people within the homelessness cohort in Plymouth. That is one of the reasons we're moving forward, and I'm sure Phil will be able to fill you in. I think we put some figures in the report on the fantastic work that Plymouth Community Homes have been doing. And you know, my hat's off to them. In December, actually 70% of their offers were being addressed in terms of the homelessness cohort, just to try and help us move things on. And that's been really positive. Obviously, that has knock-on implications, but it is really good. Ultimately, the solution to homelessness and temporary accommodation is more permanent accommodation. And we need that built. That takes time. Anyone who sat on planning committee will know by the time you get to the planning committee, it's taken a lot of time to go there, then to get everything in place and to move forward post the permission takes time as well. So those aren't quick things, but we need to be really keeping our foot down on the pipeline. And I'm looking forward to talking to the growth and infrastructure scrutiny panel about Plan for Homes, because housing delivery sits with them, in order that we can look at that and the implications. I would like to say that one of the things we have consistently been saying as a council over the last 12 or 13 years is that what we need for homelessness is not to have lots of little dribbles of money coming out for lots of little programmes. We need things rounded up. And we also need to know before the middle of April what we can spend from the 1st of April, because a lot of this is other people's organisations delivering, and people are, you know, it's people's jobs. And so really grateful that this year we have had a lot of the funding pots put into one, which gives us greater flexibility on how we work with partners, and that we've already had that announced. And similarly with winter pressures this year, in the paper you can see we got our usual tranche one, which is sort of what we would have expected. Then we got additional funding that actually increased that by double tranche one. And we've had the final figure, and there's another £550 odd on top of what we anticipated. But we will spend every single penny of that on winter pressures. So that is a change. We do need to move towards 3-year funding, because we need to be able to plan. And it's right that people like Bournemouth Churches and Path and Shekinah and others can plan for their staffing rather than having to go stop, start all the time. And finally, Chair, I would like to say a very big thank you to the people you never see in this room, who work in our housing services teams, and in all our partner organisations, who every single day deal with people who are at the very harshest part of their life, where they're about to lose or they have lost their home, quite often through no fault of their own, quite often through traumatic circumstance. And those officers who day in, day out, there's partner organisations, staff members and volunteers who day in, day out, face to face with people, provide support, provide encouragement, provide a listening ear. We couldn't do any of this without them. And, you know, my thanks go out to each and every one of them, because without them, we would be in a much worse position than we are at the moment. You know, we provided you with the facts and figures. We're happy to take questions and answer those, and maybe explore some of the things we've laid out in the report in more detail. Thank you.
Councillor Varney.
Thank you, Councillor Penberthy, and as a multi-agency rough sleeper worker for a very long time, I can attest to what you're saying. It is quite hard. And in my time doing that, in 12 months, there were, I think, 10 deaths on the street, so that we dealt with. So this is really important stuff. I just wanted to ask, the 23 units of supported housing provision, what's that going to look like? It says available to let from April 2025. Could you give me a little bit more information on that, please? Sorry, page 8, page 8. PATH and BCHA will have a total of 23 units of new supported housing provision funded through the Single Homelessness Accommodation Programme, specifically for those experiencing rough sleeping, available to let from April 2025.
Okay, so that's one of the many SHAP programmes. Maybe we should say this is Ruth's first time.
So in terms of SHAP, PATH are going to be delivering 2 houses and a total of 12 bed spaces using their MARS model, which is multi-agency response house model, which is really an intensive support model for people who are rough sleeping or have a significant history of rough sleeping. One house is already online and has been let, and the second house is due to go through and to be let before the end of March. So they will have fully delivered those 12 bed spaces. And with the SHAP programme, there was obviously capital allocation and capital money, but there was also revenue funding as well. So they have been recruiting the staff, and there are staff now in place to support the residents who are living in that first house. BCHA, the SHAP offer and provision they have is around the development of, it's 11 now, accessible homes for people with a history of homelessness and rough sleeping. So what that looks like is individual self-contained 1-bed properties with adaptations. So there's been very close working with Dave's team in Housing Standards around the development of that kind of bespoke model in terms of those properties. They have bought 7 properties. Some of those are being let at the moment, and anticipating that there will be 10 properties that will be let by the end of March, and probably one by around about April, May.
So that sounds amazing. You said the Mars team, so I'm assuming, is that the same as the team that supports, is it Wyndham Square?
There's new money through the SHAP programme, so MHCLG are providing money so that they can increase the support staff they have. So the idea is to have a similar house to the Mars house, and that there'll obviously be a bigger team to manage the extra units.
My question was just answered in that last little bit there, because it is quite intense work. That was the team that I worked in. It was very intense work, and the people that are in there are incredibly complex and in a need of great support, but also it's quite risky doing that job. So you answered my question in the last bit. Thank you very much. Thank you, Chair.
Councillor Nicholson.
Thank you very much, Chair. There are 2 points I'd like, or 2 questions I'd like to ask, if I may. First, being on rough sleeping, and thank you very much. I concur with the points that have been made in relation to bringing this report. Thanks for all the good work that staff do, Councillor Plymouth and colleagues in the department. It's a very difficult area of council provision. I think it would be useful if I could play devil's advocate, just to ask the officers to explain a bit more about the responsibility of the local authority in relation to local connection for us rough sleeping, because presumably there are people that are rough sleeping in Plymouth for which we technically haven't got responsibility. So I wouldn't mind, in the course of the answer, you could perhaps just enlighten me, but hopefully enlighten those that might be watching of what our responsibility is, and how people have the freedom of choice to go wherever they want in the country, but you can't, clearly if you turn up in Plymouth, there's not an automatic right that Plymouth would help you in that cause. I don't know if you could, in the context of that, and whether Councillor Plymouth, you might, I don't want to put you on the spot, whether you're going to be able to help this, but what nationally the government are doing to try and assist with rough sleepers that move around the country, so effectively they haven't got a local connection because they might be just generally drifting around various parts of the country. Because I think all of us, I'm sure, speak for everybody, would prefer people not to be rough sleepers, but there's an element of choice, isn't there, that ultimately if somebody wants to rough sleep, you can't do anything about it. I think it was only in COVID where there was legislation that more or less tried to encourage them with reasonable sort of persuasion to actually be in accommodation. But a lot of good work's been done. So I'd like, if I could ask that initially in relation to what the local connection is. And then I'd like to go on to something totally different, Chairman, if I may, with the housing providers in relation to occupancy and vacant property, if that's okay.
Yes.
I think you've asked a question that confuses a lot of people, and it actually changes a bit, not in terms of rights, but in terms of impact through the course of the year. So local connection is one issue. There are a number of other bits, and I'll leave Ruth to do the technicalities of that. I don't want to misspeak on something very technical. We do know that people move around. They move around more in the summer than the winter. And that's sort of normal. The other pressure in the summer is if you're sofa surfing, if you're staying with family or friends, you're more likely to stick that discomfort in the bad weather than if it's really nice. So actually there are people who have housing in the summer who choose to do that, and your right choice comes into it. But that becomes difficult for people sometimes to see. And I think it's also worth saying that just because someone says that they're rough sleeping and is asking you for money, that is a totally different issue. And street begging does not equate to rough sleeping. And actually lots of the rough sleepers will not want to make themselves visible enough by begging for money. So there are 2 different bits there. So the sort of street begging and street drinking is different from rough sleeping. There's some crossover, but they're not necessarily the same cohorts. So there are a number of bits around that can become quite confusing, and we do our best to handle those as sensitively as possible when working with local residents and businesses, but also when working with the people who are themselves rough sleeping, or working with the police when those people are aggressive beggars or street drinking. And obviously that's more the work that Sally does with Tracy Naismith. So we've not got teams in there. I just thought before I passed over on the technicalities, it was worth saying again what I'm sure you know, Patrick, that these things are not very easy, and what people present with when you're going into your local supermarket or going to a cash point is not necessarily what they say, and that actually doesn't help when it comes to then trying to solve the real problem of ensuring that people do have places to stay, and that the public understand where we need to target work. So I think that's good. If I pass on to you, because it's not just local connection, there's all sorts of other bits and pieces when it comes to rights for accommodation, which were all waived during COVID, and even with all them being waived, some people did choose to continue to sleep outside.
Thanks. So in terms of the direction from central government at the moment. There's a review that they're reviewing their strategy around rough sleeping. There's the Ending Rough Sleeping for Good strategy that was put in place, and I think some of the narrative is about people who move around areas. So within our peninsular area, people may move up to Exeter. They might move across to North Devon and come back to us. So there is an acknowledgement that needs to be much more of a joined up approach around those individuals. So that is actively kind of being discussed at the moment, I would say. And then from our own perspective, we work really closely with the Path Rough Sleeping team. So they go out 3 to 4 days a week to see who is rough sleeping. And in real time, we keep a spreadsheet of everyone's name, where we have it, and some of their basic details. And as part of that, we evidence whether that person, we consider that whether that person has a local connection or not. So we do keep that information, and that rough sleeper team, their approach is to very much check on the welfare of those individuals as well when they go out. Now, when we look at the kind of, so we look at the number of unique individuals who are seen rough sleeping every month, and we keep that information on who they are. And what we find is the team see a lot of people on only one occasion in that month. And we, when you look at that spreadsheet, you can see people moving through to Cornwall and moving through Plymouth into other areas as well. So the actual number of people who are kind of consistently rough sleeping that we're finding, and with local connection issues, where there isn't a local connection to Plymouth, is low. Really, when you look at it in the context of the wider stats.
Thank you for that. You couldn't just spell out what local connection means, please?
I would have to come back to you on that one.
Oh, it's not straightforward. Okay, I just thought for public consumption it might be straightforward, but okay, no worries.
If we can provide that as a note, because it is quite technical, and it's not just have you got a connection to Plymouth. There are some people for whom a connection to Plymouth won't be enough, and for others, when no connection to Plymouth means that we will still have a duty. So,
I'm glad I asked the question. If Councillor Penberthy and the team could perhaps provide that out of committee, that would be really helpful, just as a means of educating us.
It's funny, anyway. Gary and I have just discussed that and said, well, yes, if we could provide that definition. I know, for example, in Hull, they've got a clear definition. If you're not local, you don't get housed, and they're sort of set aside. So various councils have got different interpretations on where it fits. Something I'd like to ask is, was there enough voluntary provision this Christmas going forward with regard to the homeless and the homeless community in Plymouth?
If I can just pick up your previous statement, Chair, national legislation says who we are required to provide assistance to and who not, and it is not as simple as you have a local connection. There are technicalities around it. We will provide that in the briefing report, but I think people need to understand that this is national legislation and it isn't subject to us making a whim. We can choose to do more. We're choosing to stick to national legislation because what we don't want to do is encourage people to come to Plymouth on the basis that if they come to Plymouth, they're more likely to get services than anything else. And that's certainly accommodation services. In terms of the voluntary and community sector, we do know that one of the reasons people come to Plymouth is that our voluntary and community sector is really good. So the soup run is out every single day of the year in a really coordinated fashion, that we have really good agencies who provide advice and support. We have a rough sleeping team going out and checking up on people, looking after people. So we are known as being somewhere where the voluntary and community sector is really good. In other places where that isn't so coordinated, it isn't necessarily so attractive for people without a local connection to make a base. So I think there is that. I think in terms of Christmas, there were a lot of people doing things. My worry is that everyone does something at Christmas, and on the 3rd of January, no one's doing anything at all, other than the people who do it all year round. And I think what we need to remember is that for people who are homeless, they're not just homeless on Christmas Eve, Christmas Day and Boxing Day. They're homeless until they find permanent accommodation. And what we're really concerned about isn't the high days and holidays. It's actually ensuring that we provide consistent services to people throughout. So I would like to thank everyone who did things at Christmas, but I would encourage those people who did things just at Christmas to think how they might like to touch base with services such as Shekinah, such as the Soup Run, who are doing things on a day in, day out basis, because those volunteers are needed throughout the year. That financial support and that food is needed throughout the year. And I think we need to be thinking about people not just on the high days and holidays, but we do need to be thinking everywhere. But I would like to say that in Plymouth we have a very good voluntary and community sector who we do seek to work with closely and who do provide really good support in lots of different ways to people who are homeless.
Yeah, and I think that goes for Christian organisations as well. You know, PCC, I'm heavily involved with the Soup Run, as with other churches, and it is a yearly commitment they make to the people of Plymouth. But most importantly, if I go back a number of years, I befriended a tramp that used to go up and down Union Street. Very intelligent man, and it transpired that he was married, happily married, wife had an affair, he was a GP, turned to drink, got kicked out of the medical profession, and ended up on the streets. And we had many a conversation over a period of years, and he wouldn't accept no help. He wanted to actually come away from society as well. So I think it's recognising people's reasons also for being on the street. It's tragic, you know, sometimes it's very tragic. At the break of that marriage, turning to drink, he never a prominent position as a GP. So how do we separate those? Is there anybody within Plymouth in that current position that is not prepared to accept help, that this is now their new way of life, and no matter what we do, we will not be able to help?
I think that's always going to be difficult to talk about, and I think part of what we need to think about is actually if people choose to do something like that, that is their choice. What you've got in front of you are figures about hundreds of households containing substantially more people, and it's very easy to get fixated on relatively few rough sleepers, and rough sleepers are the very small cohort within the homelessness cohort. When we talk about homelessness, the reason that it's the Complex Needs Alliance is that it's not simple, and everyone's story is different. There isn't this is the process, if you come through the door, the sausage machine will push you out the door looking like this. For some people who don't want to engage in formal services, actually those touch points of someone just having a conversation and of listening, being really trauma informed. We use appreciative inquiry in shaping services. That's not just working with staff and volunteers, but listening to people experiencing homelessness, and as we shape things and we work in that way. But if we work in a trauma-informed way and listen and support people to a point where they feel heard and feel able and want to take any step, we'll support them in that step and we'll find the right way to do it. But it is about working with people, not doing to people. But I would say that of those people, as you heard, the majority of people rough sleeping aren't cropping up multiple times a month. So those who do are relatively few. Those are really known. I know quite often someone will mention somewhere to me, I'll mention it into the team, and they actually know who it is that's being talked about. Because through all of the contacts, through the relationships, if Victoria was here, she'd be able to talk about her team. People know people, and people are being looked after to the best of people's ability. But I think it is important to think that every single person that we talk about as homeless, whether they're rough sleeping in bed and breakfast or Airbnbs, in temporary accommodation, in supported housing, and in need of permanent solutions, will each have a different story, and each of them we do our best to package around them the support that they need, which is one of the reasons that amongst the Alliance you will find also Hamos and Harbour, and in the contractor circle you'll find people like the Salvation Army, working with people like Young Devon and the YMCA, and lots of others who will be bringing different bits of skills and expertise into that story. You know, it's why the zone are involved, so that when we're talking to young people, we're not just talking about a bed to sleep in, but we're talking about how do we move those young people on. It's why people who are doing domestic abuse and services are involved, to ensure that if a woman has fled domestic violence, we get not only the best temporary solutions that we can and we support moving on into permanent, but we're working with people like Trevi to support people, and also talking about how do we work with other abuse services to provide the right support. So it is really complicated, and whilst we can all think about the one or the two, I think what I'm always conscious of is I don't know the whole of the stories of absolutely every person. I don't really want to know the whole of the stories of absolutely every person. I don't think any of us want to know all of them, because none of us could cope. What I do know is that there are lots of people out there tackling some of them with some of the people and working in partnership. And when we're doing this, it's easy to think about those people who faced trauma. What we've increasingly seen in recent years is people who've maintained their rent, have had jobs, have got children, and are losing their home. And the reason we've got so many families coming through the process at the moment is, in recent years, the nature of homelessness has changed because of the cost of living crisis and the accommodation costs rising substantially. And if you were to look at any of the surveys at the moment of what average rents are for flats or even rooms, an average rent on a room in a flat now, 4 or 5 years ago, you could have rented a flat for. And that is just pricing working people in Plymouth out of the housing market. That's part of the housing crisis beyond our control, but where we do step in and support. So that's why I think, whilst I acknowledge that there are some people who are really difficult to choose not to, and we were working with them, we're actually working with a lot of people who are never there. We never want people to get onto the streets, and we try and stop them getting there if we can.
All right, just to put things into perspective, Councillor Nicholson had a second part to his question, so for your continuation, then it's Jeremy and then Zoe on the list. Okay.
Thank you very much indeed, Chair. So it's a completely different aspect, and it's around the availability of accommodation, and principally wanted to sort of address our colleagues that have joined us from Plymouth Community Homes and Live West in relation to vacant property and the turnaround of property that's perhaps subject to an old tenant moving out and a new one being allocated, and repairing properties so they're fit for purpose. So are you able to share some statistics in terms of how many properties you have and what the percentage would be vacant, and perhaps we can discount any redevelopment, so like Barton, there's property being knocked down. So property that's would be ready to, you'd want to let, but is sort of between tenants, would be very useful, because something we used to sort of monitor donkeys years ago when we had our own housing stock.
Shall I go first, Phil?
Yeah, that's fine, yeah.
Okay, well, I'm coming in from a development background, so I've not got a people background, so I'm in a bricks and mortar type perspective on the conversation. So I can't tell exactly how many voids we turn over in the city within a 12-month period. I can tell you that Live West has just over 3,000 properties in Plymouth. Void rates are not high at the moment. We do work with Devon Home Choice to prioritise voids that do come up where we can for people with a preference for homelessness, particularly one beds. On new build schemes, we have also worked with Devon Home Choice to try and allocate a proportion of those with a preference to homelessness as well, albeit on new build development. Obviously, we have a lower percentage to make sure we still sustain a balanced community. So I can't give you overall numbers in terms of voids, but I can tell you that's our stock and sort of our approach to things. At present, obviously, we're looking to invest in Plymouth. We have had a history of investing in Plymouth, along with a number of other housing association partners in the city, and that our aim predominantly there is to deliver permanent accommodation to obviously boost the city's overall stock holding, and obviously that obviously goes some way towards obviously increasing the opportunities to house families or individuals who are homeless. At present, we are averaging about 30 to 40 homes a year new build. It's typically general needs housing or flats, but as Councillor Penberthy explained, there's a broad range of households that do require accommodation, and therefore obviously hopefully the breadth of the accommodation we provide is suitable for that purpose. We have done some work on an ad hoc basis in terms of specific projects that are focused on certain groups. We've done a couple of veterans projects in the city in the last 3 or 4 years, which has gone some way, I think, to helping with that particular client group. And I think those have been well received and very worthwhile projects. And I think there's an appetite to do more of that sort of project in the city to support the strategic aims of the local authority. But that's our perspective on it. If you want specific numbers on void turnover rates in the city, I can go away and collect those for you and feedback separately.
Thank you very much. I think that would be very useful, just so we know that there are properties. We tend to look at the private sector and say property is empty and chase those, but it would be just useful to have some statistics and appreciation that hopefully it's a low figure, but what the figure would be. So thank you very much indeed. Thanks.
Shall I jump in now? So I can, for Plymouth Community Homes, we've got approximately 15,000 properties in the city. We average around 10 voids a week, which on a rolling programme, about 77 void properties in the process of being made ready to let. Our average, we've got a routine void time and non-routine. So our average routine void time is currently around 31 days, and our average non-routine is around 41 days. And we're working hard to bring that number down as low as possible, but looking at a number of different projects to kind of help with that. It's made up to that figure is made up of 2 different stages: the void repair stage and then the letting stage, and those 2 numbers together make the sort of total time. I say we've got 15,000 properties, so the largest provider in the city. We work very closely, collaboratively with Plymouth City Council to tackle homelessness and help our communities to thrive. Just some figures around our homeless lets. For the year to date, we've let a total of 294 properties to homeless applicants, which is up from 260 for the same period last year. Lots of work's going into that with between the 2 teams. And like Councillor Pembroke said, we've currently piloting increasing the 50% homeless preference up to 70%, which we've been running since November, and we'll run through to the end of March to kind of see what impact that have. So corporately, we've got a real focus on helping with the homelessness crisis. And like I said, we've got a number of work streams that are running collaboratively to help tackle that, including breaking down any barriers to our properties. So we're working with Jackie Kings and her team at looking at, for example, if there's historic arrears, how we can take away those barriers to prevent anyone being able to occupy our properties. We also have got a large development programme, which we're aiming for 300 properties per year. Majority of them within the City of Plymouth, but obviously got a slightly wider development programme now, up to an hour outside of the city. And included in that development programme, we are targeting some bigger properties. We've put in for looking to build some 4 and 5 bed properties, because we know that there's a need for that, and some of the families that are in temporary accommodation for long periods are because there's just not the availability of the bigger properties. I think as well, just to kind of back up the stats, there's some quite powerful stories that sit behind that. So we mentioned Hillcrest. We've got families who moved into there, who've been living in hotels for over 2 years, and now they've got a permanent home, and they're sort of putting down roots, and that community's building. So some really good work that's going on, and certainly more that we're looking to do, working closely with the local authority to see how we can make a real impact.
If I might, Chair, I'd just like to thank both Plymouth Community Homes and Live West. In terms of Plan for Homes, they are both strategic partners of the council, with signed agreements of work we are doing. As you can see, each has a slightly different focus, partly because of volume and partly because of geography, and we welcome both of those. We're currently in the process of developing a 3rd strategic alliance with Bournemouth Churches, and Nicola apologises she's not here today because she's actually at a CMT away day, part of which is talking about the extra investment that Bournemouth churches are seeking to put into Plymouth as part of that strategic alliance. So please forgive her not being here, because she would have been really keen to come and talk about that. But I think the work that we have been doing shows the importance of those really in-depth relationships that don't just sit with one team and aren't just about building new homes, but are about those broader issues. And so our tribute to them, I thought I would just rehearse quickly, because delivery is part of this. In the last 9 years in Plymouth, we have had 7,581 new homes built, of which 1,980 were affordable. That's 26%. Of the affordable, 65% were rented and 35% were low-cost ownership. And that's up to the end of 22-23, because there's always lags in those. At the same time in that period, we did a lot of work on council intervention through our land releases. And on the plan for home sites, which are the ones that are predominantly the ones that Plymouth Community Homes, Live West and a few others like Westwood have been working on, we released 50 sites. On those, we've already had 1,543 new homes built, of which 1,015 were affordable. So on the sites that we've intervened in, that's 66% affordable because of the work. And what these gentlemen haven't told you is that those are energy efficient homes. Those are homes that are accessible. They're homes that, we've built bungalows, we've done all sorts of things that meet specific housing need. So, when I talked about we need to deliver new homes, these are two of the organisations that are really making that happen. And I thanked everyone earlier on homelessness. I'd like to thank the part that PCH and Live West have done, along with others, in levering their investment and other investment into the city to help us tackle the housing crisis.
Yeah, thank you, Chris, for that contribution. I think it's just 2 points I'd like to break down here with regard to both Live West and Plymouth Community Homes. And we do thank you for your participation here today, and thank you for your contribution also long-term with regard to helping the council alleviate the crisis we're currently in, or not so much the council, but the current situation with regard to the people obviously on the Devon Home Choice and the people that need to be housed. Of the 30-40 houses that Live West, how many are going to be for social rent only? And of the 300 that Plymouth Community Homes are looking to provide, how many are going to be for social rent? And how do you define, I'm trying to think, affordable housing? What is the true definition? We hear this bandied about, but what is the true definition of affordable housing, please? Can I give that with Phil and Robert, please?
Sure. I mean, I'm not sure I can tell you what the definition of affordable housing is, because it varies, and it means different things to different people, and it depends on the local authority's own definitions and their own planning policies as to what is affordable. In terms of social rented, so if you take the last 2 years, Live West have delivered about 80 homes, and 64 of those have been for social rent. So the majority of what we've delivered has actually been social rent in the last couple of years. We've been able to deliver social rented homes because we've levered in Homes England grant funding to support us deliver those homes as social rent, which I think is really great. We do try and endeavour as far as we reasonably can to deliver as many homes for rent as social rent as possible, because we know that they are more affordable than the alternative affordable rented model, which is based on 80% of the local prevailing market rent capped by LHA. So that's really good. Typically, of the rented homes we deliver about 50-50 across our whole geography at the moment between affordable rent and social rent. So actually in Plymouth, we've delivered higher than our average proportion of social rent. So hopefully that's welcome news to you. So and going forward, it's similar. I think we're delivering more than 50% of all rented homes as social rent in Plymouth using Homes England grant funding. So we recognise that's best meets the needs of those needing rented accommodation, and that's what we're endeavouring to provide. Pass over to Phil.
Yeah, thank you. I'll need to get specific information from my development colleagues, but certainly our primary delivery is social rent. So we've made a commitment that the new homes that we do deliver will be on a social rent. Obviously, they're affordable makes up a proportion of that, and we deliver shared ownership properties around that. But I can get a breakdown of exactly what we've delivered and also what going to be delivered over the next 5 years, and provide that as an addition if that would be helpful.
I think to the members of the committee that would certainly be most helpful to have a breakdown, because if we know how many social houses are coming online year on year, we can correlate that with the people that obviously we need to house and work out where the disparity is and what we're going to do to bridge that gap at that time. I certainly think it would be most helpful to the people on this committee if you could do.
Absolutely. No.
Right.
Yep, I'll get that provided, no problem at all.
That's great. Thank you, Phil.
Chair, can I just quickly, actually part of the reason we manage social rent so well from Homes England is that the Housing Investment Fund that I established a number of years ago, having begged and borrowed some bits of money and managed to keep on them circulating, means that the council also subsidises not just through reduced land values, but quite often topping up viability gaps, which would otherwise mean those weren't social housing. But because we do that, Homes England are more likely to put grant into Plymouth for social housing. So I think actually we do have a bit of a role to play that is worth acknowledging, and actually the starting point for both our strategic alliances with both Live West and Plymouth Community Homes are a discussion about how we invest £1 million to help them to secure more affordable housing, especially social rent and special design housing. So we have those ongoing discussions about where that money gets spent, and I think it's important to note that we've got real skin in this game, and without that we probably wouldn't get as many being delivered as we are. In terms of social rent, there is a bit in which that fits into housing associations' previous models, because each will have a different rent structure. And so I know Plymouth Community Homes is, I think, the third cheapest housing association in the country, because we were not very good at putting people's rents up, because no politician ever wanted to do that. So when the stock transfer happened, they were slightly disadvantaged. Market affordable in terms of rent is 80% of the local market, capped by LHA. So ours will increasingly now be at LHA, because LHA is substantially less than the market. But also we allow within our planning policies issues around shared ownership, and there can be various models of shared ownership, and also rent to buy, things like Rent Plus. A lot of those bits actually sit in housing delivery, and that bizarrely, like lots of my portfolio, sits across a load of places. So all of the scoping of what that does, how it gets done is managed through planning, and therefore sits within the growth and infrastructure bit, which is why I'm going to be going to growth and infrastructure to talk about those sorts of issues at one of their committee meetings, because housing crosses, in fact, all 4 scrutiny panels. I'm working at the moment with Councillors Aspinall and Lang on the need for specialist housing around children, young people, and people with physical learning and other sensory requirements. So, this is one of those bits that has tentacles all over the place. So just so you're aware, there are some bits that would be picking up a lot more with the growth committee when we look at the housing delivery numbers and everything else. So just so you're assured that we're making sure that every bit of housing gets scrutinised by the appropriate panels.
That's brilliant. Thank you, Chris. Councillor Gosling.
Thank you very much, Chair. The new government announced a sizable uplift in the homeless prevention grant this year of £192.9 million. That's that's a 43% increase over the previous year. So this translated from your notes into over £600,000 increase in the homelessness prevention grant for Plymouth. How is that going to translate to improvements in the provision of services for homeless relief in Plymouth over the next year?
Obviously, we got the figures just before Christmas, so we're still relatively new in. We're really pleased that we're being asked to spend a lot of that on prevention. If Victoria was here, she'd be telling you that that's part of what she's been pushing me on, and which I've been pushing government on along with the teams. And that prevention work can be a whole range of stuff, and can include the work that we're doing, not only to stop someone on a homelessness presentation not becoming homeless, but once someone is homeless, how we prevent them staying homeless, and if they're housed, how we prevent them becoming homeless again, because it can be a cycle, and it's a cycle we want to break. So at least 49% of the money will be spent there. We will work with our partners to work out exactly what that looks like. The rest of it is to support some of those other temporary accommodation revenue costs. The way we fund the Alliance means that we will have some conversations with the Alliance, which we're part of, about exactly how that will all pan out into provision of beds, services, people, and also some of the increased costs that they will be bearing because of increased costs generally, not only of employment, but cost of living and other bits that are making their services harder to deliver. So we will be working it out with all of them. But I think it is worth acknowledging that not only did we get over 3 months' notice of what that award would be, that the awards were rolled together, so we know which bits are in there. Those will all be protected, but it gives us flexibility to move between them. But also that we got that extra, just over £700,000, in fact, which was really positive news, because it enables us not to think, oh, we're really confident, but as I said to Budget Scrutiny, it enables us to say we feel that we can deliver on the budget we've got, because we have been pushing money into prevention, and in pushing money into prevention, that pushes services elsewhere. So it'll just help us balance as we go forward. But it will be all sorts of different things in lots of different places. I'm really conscious of the fact that the work that Young Devon are doing with the YMCA Exeter at Plymouth House, that's going to be amazing. What can we learn from that? What will that lead us to as we do more work in terms of prevention with young people, especially with care experienced young people? What are we doing more to support domestic abuse and domestic violence? When I look at our figures for why people come to us, last year and this year to date, 11% of the presentations for homelessness are because of domestic abuse. And that is a horrific figure. And so, I would be interested, as we talk this through, and we're still in the early stages, what does that mean for women and children whose mothers are the victims? Because it tends to be women, almost all of those cases are women. So we'll be looking at that, and that will mean, what do we do with Trevi and others to see what we do to prevent that, to support that more, and to enable those women to move forward in positive ways. So there'll be lots of small bits that money will be spent on, but we'll be looking at building on the successes we already have, rather than saying, oh, we've got a bit of money, let's create a whole new programme, but rather deepening what we're already doing in order to try and make those services better.
Zoran?
Thank you. I'm glad that you've just said that, because my question is kind of to that, but it would be remiss of me if I didn't, for my ex-colleagues who probably are listening, we need to be careful when we say people are street homeless by choice, because I don't think I've ever met anybody that woke up in the morning and said, I don't want to sleep in a bed tonight. I just want to put that out there. There is a lot of complexity. There's an awful lot of complexity going on. And so there are so many people working. There's Trevi, Spark, Shekinah, drug people that work through this. It's not just a choice. It's a lot more complex than that. Councillor Penberthy, I just wanted to touch on the domestic abuse safe accommodation, and you've just sort of said that there's money going into that, and the whole government putting stuff into it is really good for us to hear, especially in the work that I do. I just wonder how long do you think, or how far do you think the travel will be to gain the key objective of ensuring that safe accommodation from the Domestic Abuse Act? Thank you.
I think this plays into a whole big ball game, and Ruth and Dave will know that at the moment we haven't quite published, but we've been working on for a while, our supported and specialist housing needs assessment, which has, I think, 12 chapters relating to different specialisms and support needs. That's quite complex, and having seen those first drafts, they're currently out with councillors Hayden, Lang and Aspinall for them to make comment on, so they're back talking to their teams just to check that their teams have given our teams the right information so that we know. That gives us a sense of, in the next 5 years, what do we forecast the need is. The early indication is that that is a scary figure. It's going to cost us a lot of money to meet. We currently aren't legally required to have a strategy. We soon will be. And what we are now, for all of that, So what we will then begin to do is say, okay, so how does this begin to break down? How do we eat that elephant? Because it is a massive elephant. When we put that on top of homelessness and general needs, because we have to be really careful that we don't do everything for everyone else, and someone who just needs housing doesn't have access to housing. So we're in the process of doing that. So I don't think I can give you an answer at the moment, but what I can say is that we are actively working on it. And one of the bits we've said is that some of those chapters we need to finalise earlier, and that's one of the ones that's right up front to be done quickly. Once we've signed all of that off, we'll probably publish them. We need to work out how we publish them, because there's an overarching bit that needs to go with it, and how do we publish a chapter without having published everything else. So we might publish chapters in draft, even though they won't change substantively. So we will do that. We will then begin to look at what does that look like in terms of bricks and mortar, and what does that look like then when we talk to people not only who build, and I know at the moment that Plymouth Community Homes are talking to us about the needs in terms of some of our young people and care experienced young people. We need some bricks and mortar solutions, but we also need some provider solutions, and it's about bringing the housing associations and the providers together with us in ways that work, and each one of those is going to be a bit different. So we will tackle it. We'll do that. It'll be more complex, but it'll be building on the sort of relationships that Live West built with us, and Homes for Returning Heroes, or Homes for Heroes, which is now Alabare, but the work on building for veterans, which actually meant that those were slightly more expensive to build. They took a bit longer to build. They were more complex to build, but we get better results at the end of it. So we will be working with our partners as we define the need to say, okay, how can we chunk this up amongst everything that's happening, in order at the same time to ensure that we build balanced communities. What we don't want is a community where everyone's a young person who's been in crisis, and another is a community where everyone's had armed forces experience and nothing else. So it's also about how we do that, how we do it sensitively, how we protect people. It's why we quite often don't want to talk about which bits go in which plots, or even on which schemes, because sometimes it's appropriate, but other times it's about supporting the people who are going to be living there. And I remember a number of years ago, someone who was objecting to a women's refuge in their ward, which was a secret address, named it publicly to get support against it in a planning committee. I don't think that any current councillor would do that, but you can see how quickly it can flip, and I want to look after the vulnerable people. I can assure you, it's right up there on our agenda, and I wouldn't be able to get away without it. In a week where on Monday night I attended a vigil for Claire Chick, which was not a domestic abuse issue. It wasn't. It was a stalking issue. It was a whole different ballgame. And we have Reclaim the Night on Friday. I think it's important to remember that there are vulnerable women who make up a big cohort that we need to look after. It's on our agenda.
Just really quickly, I just want to say
Yeah,
thank you,
just a quick one.
and I
We've
know
got
that you
Councillor
will.
Poyser
I know
and
that you will,
Councillor
because
Nicholson
obviously you have done. And also, while we have Phil, I was part of those conversations previously on the board, no longer on the board, but with the children, young people, and the domestic abuse. So I'm sure it will happen. I just wanted to make sure I had it on record asking. Thank you.
Yeah, Councillor Poyser. Sorry, Councillor Poyser.
Thank you, Chair. Whenever we get updates on homelessness and rough sleeping, it always kind of it's such an incredibly complex subject. And sitting here listening to, the panel today, giving us an update, always a reminder of, it's just there's no straightforward fixes to this, given the complexity of individual needs as part of this. But also as well, the organisations and groups that we're so lucky to have working together in this city, doing some fantastic work, and there's clearly some great work going on and some improvements being made. I'm looking at some of the data here as well, and I think you alluded to it earlier on about a number of households with children, expected children in bed and breakfast going down in the 12-month period. That's clearly going in the right direction, isn't it? So that's kind of just one of probably many successes. This is just like, I'm just looking at the data. There's a whole series of KPIs in here as well for a 12-month period. Do these KPIs go back further? Do they go back sort of, how far back do they go? Because we've had we've had successive governments changing, we've had policy change, we've got obviously we've got lots of new initiatives coming out now, and we've got a growth agenda to build houses, and it'd be really good if we could see the impact of not only past governments, but obviously the impact we're trying to make now, and whether there's any sort of trends there that so the public can see trends and changes, and we've got sight of that as well.
Yes, and obviously we publish the headline data set in the performance reports, which now come out twice a year, which is twice as frequently as most councils do them, I hasten to say. But we do those, and there is a section in there because it's a corporate priority on housing. It won't go into the depth that this goes into. There's a whole load of stuff underneath this. How far the data sets go back will be slightly different for every data set, because quite often it's we start asking a question, and so we start pulling the data together, and we haven't necessarily got the means of extraction from old data without spending a lot of time. Some of them also go through blips. So one of the things when I'm the cabinet member is, and Jackie would tell you this if she were here, I keep on asking about, are we managing Devon Home Choice Register? So not are we just registering people, but are we also making sure that people on the register still need to be on the register? So you will spot that the register quite often does this. And it's because we have those points where we do some big management. The creep up in the register isn't a management issue now, because we are actively managing the register at the point it's growing. And it's useful to know, because I'd rather say it's terrible it's growing than it's growing and growing and growing, and I don't know, there's no real management. And the last time we did that, we knocked 5,500 households off the register, purely because they didn't want housing anymore, they'd moved away from the area, they were an older person who's moved into care, and all sorts of things. So actually that management is just the normal churn, and it's important we do both. And we now have built that into business as usual. So each of these bits will have a different set of bits. We're always happy to come. We've said we'll come back. I'll trail something that will happen at Cabinet next time, because there was a budget scrutiny recommendation about reporting 6 monthly on homelessness, and I can tell you that we've agreed to come back and report to you. So every 6 months we'll be coming in with a homelessness update. If in that there is something you want more detail on, we won't go and do absolutely everything, because obviously that's an enormous amount of officer time. But if there's something you want more detail on, ask for those specific things. Very happy to provide them where we can. But what I don't want to do is ask officers to produce vast amounts of stats, because I'd rather they got on with the job of helping homeless people as much as possible. But I do want at the same time to be really open and transparent where I can. So if there's stuff you want exploring, just let us know. In 6 months' time, we'll come back with that detail, because as you said, it is really complex. And it might be you just want to deep dive into one part of it or a couple of parts of it. We'll give you the overarching update on all of this with anything additional you ask for.
Thank you, Chris. Yeah, I mean, the corporate reports are, you know, they don't go as granular as this. And I certainly wouldn't want to ask officers to go out their way to kind of pull data from elsewhere if there's no value to it. If there are sharp changes in changes, that's explainable. I understand that. But if there is data there and we can use it, and it's easily presentable to this panel and to the public, then I think that would be really informative.
I think our plan is to bring an update report. So it was then if you wanted to say, actually, what does it look like in terms of domestic abuse, or what does it look like in terms of this? We can do some deep dives on data going back and what we understand on specific areas. Really happy to do that, rather than just produce lots and lots of long-term data for 6 monthly update reports. Partly it makes it easier for you, as well as easier for the team.
Sorry, and it was just to touch on, my worry would be, I mean, there is data around homelessness and breaking it down. It's what you can meaningfully conclude from that historical data. And my note of caution would be that you can look at that data, but without knowing the relevant context at the time, which can be really complex and multifaceted, people could draw the wrong conclusion. So I just wanted to add my kind of words of caution around lots of historical data for conclusions.
No, I completely understand the caution there. I think, but with all data, we can form some kind of narrative around it, can't we? So it's not misrepresented or misunderstood in some way. But there's no point in presenting data for the sake of data. But if the panel wanted to agree on what we need to see and what the public might like to see, that might be useful. then maybe that could be done outside of this meeting.
And, you know, I totally agree, Councillor Poyser. I think on page 11, a typical data set is 6,801 in May 2024, 7,799. Now it's an increase of 1,000 people now on the Devon Home Choice requiring housing. So I think that is a very relevant statistic, for example, that's brought back to here to see how are we bringing it down? Where are we going with it? It's the elephant in the room, really. We'd love to be able to house all 7,800, but we haven't got the properties to do it. How are we going to get there and do our best in the current circumstances? Councillor Nicholson.
Yeah, thank you, Chair. And I do apologise. I'll need to leave in a few minutes, but after this question. Councillor Penberthy touched on the housing needs assessment, which does feed the local plan, the joint local plan that we signed up to. And I just wanted, hopefully very briefly, Councillor Penberthy, the announcement of the Plymouth and South West Devon Joint Local Plan Steering Group that we wouldn't be renewing a joint local plan. What your view is in terms of its impact on delivering the housing need of Plymouth, given the fact that the joint local plan delivered housing need for Plymouth in parts of South Hams? Thank you.
Yes, I think this is a complicated one. The legislative framework within which we're working before the general election and since the general election actually changed, so renewal of joint local plans became a lot harder. We had therefore been talking about it for quite a while in terms of, we did the 5-year update, but where did we go next? We're now in a position where we have to make a statement to government about our intentions on where next. And so we've put out a marker that we will be doing more work, but it won't be under the current model. Local government reorganisation means that 2 of the 3 partners in the current joint local plan won't exist post reorganisation, and the partners who are our new neighbours, we will have a different set of duties statutorily to deal with, and those will be developing local plans for the first time. So we're at a slight advantage there. Once we're through the process, we'll have a better understanding. The needs assessment I referred to was the very specialist and supported housing needs assessment. There will be all of the processes going forward. However, we're in an interim period. The joint local plan is still the planning policy of all 3 authorities. All of the supplementary documents that go with it are still the planning policies of the 3 authorities, and until new ones are established, they will be the basis on which planning decisions are made. So the slight allocations remain and everything else. We know that the targets of the previous government and of the new government are putting pressure on especially urban areas to increase housing. We have made no secret of the fact that we wish to build a new town in the city centre and are looking at what that means, not only within the ring road for new homes, but outside. You know, could we get to a point where we actually class as a new town for the New Towns Commission within the city boundaries? That's being talked about by Manchester and Sheffield as well as options. So, you know, those are the sorts of things we're looking at, so that we look at intensification. But the way we meet the needs of the housing register, the way we meet the needs of other people who are not on the housing register with housing in the city, is that we need to build more homes. And not all of the homes will be able to go high, and that does mean we will have to make some difficult decisions as a city about where people who are Plymothians can live. And I hasten to say, contrary to a lot of the comments you might see on social media and Plymouth Live website, we are talking about people from Plymouth who need housing. And, you know, we need to support those people to be housed, and that means we need to build more housing. So it is a marker that we needed to put down. We needed to be clear so that people knew the directions of travel. Obviously, for our colleagues in South Hams and West Devon, it's a bit harder. Similarly, harder for Devon County Council. And it's hard for us because we don't quite know where our boundaries might be, though, you know, there are, as you're aware, we've had some early comments about where we feel those might need to be. We already know quite a lot about those patches. There's already plans in place in the joint local plan. We wouldn't want to detract from that. We wouldn't want to say we are going to concrete the South Hams or the West Devon or wherever else. It's more about the sensitivity of those developments. But yeah, it is a direction of travel. It does mean that the needs assessment will change because we'll end up with a different cohort being added to the city's population. It'll be a proportion. You know, we need to grow by about 20%, if that, 15 to 20%. So it will be a different thing. But also, the people we're acquiring into the city have very different socioeconomic profiling, which will change where we can make some provision and how we make that provision. So, you know, it's all, we're spinning lots of plates, but we're really cognizant of all of that as we do it.
Thank you very much, Chair. Thank you, Councillor Pemberton.
Needless to say, I'm going to be bringing this to an end now. Thank you, Councillor Penworthy, for your contribution on the team with Ruth and Dave, and also to our guests today, Robert and Phil. I'll be grateful if you know, the statistics that we looked at, if you could promulgate them, would be much appreciated going forward. But again, I say thank you for your input this afternoon. It's been very valuable, and I hope the committee has found the input valuable as well. So needless to say, I'm going to be moving on to the recommendation. Well, there is a recommendation on this one, is to note the report. So there's no. Regard to the work programme, pages 35 to 38, is for you to note the work programme. Is there anybody like to offer anything with regard to the work programme that was? Go on, Councillor.
So it's just a quick one, which might make your life a little easier. The Child Poverty Plan and the Cost of Living Task Force both now fall under Building Bridges to Opportunity. So you might want to put those two together and do a scrutiny on Building Bridges to Opportunity.
Thank you for your contribution there, much appreciated. If you could note that, please, Rose. All right. So the action on that point is to discuss and agree the committee's work programme. What we're looking at is having another meeting in April, because there's no elections this year, because we have got some catch up to do. So what we were going to say is, rather than sort of waste people's time this afternoon, Tess and I were going to get together and discuss if there's anything, let's put it this way, if there's anything you think should be inserted into the April programme, please get back to us. Let's make it easy, all right? And then Tess and I will discuss it then, we'll get back to you. So that will fill that gap as well. So tracking decisions, the committee will be asked to note its tracking decisions. And thank you all very much for your time this afternoon and your input. It's been much appreciated, and look forward to seeing you all at the next meeting. Take care. Meeting is therefore closed.